Diabetes-free India. How is it possible? This is the second video in the World Diabetes Day 2025 series, a 5-part journey to help people everywhere understand how to live free from diabetes. In India, very few families remain untouched by diabetes. Perhaps a parent, sibling, or friend of yours is also living with it. That's why every Indian family and every Indian caregiver needs to understand this message. In the previous video, we explored the root cause of diabetes and the science behind a diabetes-free India. If India is to rise to global leadership in health, the first milestone must be diabetes-free India. That is the first step towards the true health freedom. Think about this. For sugar, pressure, thyroid, joint pain, or heart disease, many people visit 5 or 6 specialists and take 5 or 6 medicines, one or more for each problem. The World Health Organization classifies all these diseases as lifestyle diseases. So, are these diseases truly different, or are they different expressions of one single underlying cause? That is what we will explore today. For most people, daily life revolves around tablets for sugar, pressure, cholesterol, pain, or thyroid and fatigue. Health freedom means breaking that dependence, where medicines and surgery are used only in emergencies, not every day. We must understand this simple truth. Knowledge and commitment are more powerful than medication. A life without chronic disease or chronic medication, that is true health freedom. To achieve it, our focus must rest on 3 pillars. 1. Right knowledge, understanding the real root cause of disease. 2. Right application, using that knowledge wisely in daily life. 3. Right evaluation, use scientific monitoring and clinical support. When you become an informed patient, you begin your journey towards a disease-free future. Today, modern medicine divides the body into many compartments. Endocrinology for hormones, cardiology for heart, nephrology for kidney, neurology for brain, and so on. Even within diabetes care, every affected organ has its own specialist. Eye surgeon for the retinopathy, pediatric surgeon for foot ulcers, cardiologist for heart blocks, nephrologist for kidney, etc. Hospitals grow more advanced, specialties and specialists increase. Yet, number of patients continues to rise. Why? Because the true root cause is rarely addressed. That root cause is chronic inflammation, a slow, silent, smoldering fire that burns within the body cells. This root cause is not addressed or ignored. This is why conventional treatment only manages symptoms but never end the lifestyle disease. To understand healing, we must understand immunity. Your immune system is your inner doctor. It maintains health, heals wounds, and restores balance. It has 2 vital roles. 1. Defense or inflammation, controlled by omega-6 fat, helps defend the body. 2. Healing or anti-inflammation, supported by omega-3 fats, helps repair the body. When harmful substances enter, whether from unhealthy food, alcohol, pollution, stress, or chemicals, the immune system triggers inflammation to protect you. But modern living keeps this fire burning continuously. Excess omega-6, low omega-3, and hidden toxins in food and environment pushes the immune system into overdrive. And that constant defense mode becomes chronic inflammation, the foundation of all lifestyle diseases, including diabetes. So, if you want to heal, you must learn how to support your immune system rather than constantly suppress it with drugs. Every illness speaks through symptoms: fatigue, fever, pain, redness, or swelling. These are not the disease itself, they are signals from your immune system saying, "Help me restore balance." But many modern treatments simply suppress these signals instead of addressing the root imbalance. When we strengthen the body with the right nutrition, circulation, and rest, the immune system can complete its work and true recovery begins. When immunity loses rhythm because of poor diet, lack of nutrient, or toxins overload, disease takes hold. Our goal is to restore rhythm and balance through lifestyle correction, food, movement, rest, and detox. That is the path to natural healing and freedom from chronic disease. When you injure your finger, the area becomes red and warm. That is acute inflammation, a healing response. But inside many people today burns a hidden, constant fire, chronic inflammation. This silent fire damages the blood vessels, weakens organs, and triggers most lifestyle diseases: diabetes, hypertension, heart disease, arthritis, fatty liver, and more. It affects every organ system. 1. Blood vessels, leading to diabetic retinopathy, neuropathy, nephropathy, and memory loss. 2. Joints, causing arthritis and chronic pain. 3. Heart, promoting fat deposits, high blood pressure, and heart attacks. In type 2 diabetes, both high sugar and high insulin damage blood vessels. The disease may seem to affect different organs, but the cause is one: inflammation. Medicines can temporarily suppress it, but cannot remove it. Long term drug use, in fact, can add to the toxin load, burdening the liver, kidney, blood vessels, and immune system. The only way to extinguish this fire is through precise lifestyle correction guided by science. Each medical specialist focuses on their organ. A cardiologist focuses the heart, a nephrologist the kidney, and ophthalmologist the eyes. But who looks at the whole person, the system that ties them all together? Lifestyle, diet, and metabolism, the true root of disease, often fall outside traditional treatment plans. That's why patients keep adding doctors and medicines, yet remain unwell. The gap between disease management and disease reversals lies here. If we correct the common foundation, chronic inflammation and lifestyle imbalance, the entire body begins to heal. This is where the concept of holistic integrated medicine becomes essential. Here, the integrated medicine doesn't mean integrating all different systems of medicine like modern medicine, Ayurveda, Homeo, Unani, etc. What we want is addressing not just the parts, but the whole human being. At first, chronic illness may look complex, but when we look deeper with the science, the solution is simple. Step 1: gather the data. Identify your hidden inflammatory triggers. Measure your nutritional gaps, hormonal imbalance, immune strength, and toxin levels. Step 2: create a personal plan. Based on your data, design a program to help cell regenerate, restore organ function, and reverse inflammation. This is not a one size fits all plan. It's a scientifically guided, individualized lifestyle correction. As inflammation subsides, insulin and glucose level normalize, blood pressure falls, arterial blockages regress, joint pain eases, and energy returns. When the root cause is corrected, multiple diseases are reversed. Lifestyle diseases all share one real medicine: lifestyle correction. Type 2 diabetes is no exception. By restoring the body's natural balance, we extinguish the fire of inflammation, reduce excess insulin, and protect our organs. This is the moment to reclaim clarity and health. Let us move from confusion to science, from management to healing. In the next video, we will explore how lifestyle correction can help prevent the major surgeries and complications that people with diabetes often face: angioplasty, bypass, kidney transplant, knee replacement, amputations, and more. We will see how prevention begins long before surgery becomes necessary. Another important aspect is when someone is talking about healthcare and newer treatment approaches, you should consider the scientific background of the concerned person. I am Dr. Jolly Thomson, started medical education in Government Medical College, Kottayam as 1981 batch and completed diploma and MD in obstetrics and gynecology from Government Medical College, Tirunelveli, Kerala, India in 1992. After additional training in reproductive medicine, surgery, and painless labor, joined government service. Later, I resigned from government service and in 1997 started practicing as consultant at Life Care Center, Tevara, Kochi. I focus on lifestyle modulation with the clinical support, minimizing medication and surgical interventions for lifestyle diseases. The idea that diabetes requires lifelong medications must change. Medicine control numbers, they do not restore health. Scientific lifestyle correction is the true and lasting solution. Let us build a movement for diabetes free India. Every family that becomes informed, every person that takes responsibility for their health adds one more step towards the dream. Share this message with your loved ones. Let us replace fear with knowledge and dependency with empowerment. Together, we can create a diabetes free India. To know more about diabetes, metabolic health, and lifestyle correction, visit our website and explore the other videos on this channel. In the next episode, we will look at how to prevent surgeries and complications and protect the eyes, heart, kidney, and nerves through scientific lifestyle recovery. Stay informed, stay inspired, and stay committed. Because when we correct our lifestyle, we correct our future. In the next episode, part 3, we will explore how people with diabetes can avoid high risk surgeries such as angioplasty, bypass, knee replacement, amputations, eye surgeries, and even kidney transplant. We will also look at how to protect your sight, hearing, memory, and sensation, and practical steps to prevent heart attacks and strokes. Don't miss it. Watch, share, and invite your families and friends. Our goal is diabetes free India. Let us get there together. Thank you. Diabetes free India. How is it possible?